Hi everyone, my name is Summer. I'm a current M3 at NSU KP and today I will be presenting my case on drug-induced sweet syndrome by Scopri. This is in collaboration with the dermatology residents at Larkin Community Hospital in Miami. So, acute febrile non-vasculitic neutrophilic dermatosis, also known as sweet syndrome, it's a pretty rare dermatologic condition that usually affects females from ages 30 to 50 years old. And it's characterized by the sudden onset of painful erythematous bumps or plaques of various sizes, usually in an asymmetric distribution. And it's accompanied by systemic symptoms such as fever, leukocytosis, and on biopsy, you would see a diffuse neutrophilic infiltration in the reticular dermis. So our case report is on a 34-year-old female who, with a history of epileptic seizures, and she presented to the clinic with these scattered erythematous bumps on her upper arms, and you can see the picture of that in figure 1. And the patient had no previous history of similar lesions. She didn't have any trauma, notable exposures, or significant changes to her skincare routine, but she did say that these symptoms started after adding Scopri tablets to her medication regimen. And Scopri is currently FDA approved for the adjunctive treatment of partial onset seizures in adults with epilepsy. So on dermatological exam, it revealed closed vesicles on the erythematous base with a trailing scale on the lateral left upper arm. And a punch biopsy of the lesion confirmed the diagnosis of neutrophilic dermatosis consistent with sweet syndrome. And so we instructed the patient to discontinue the medication and apply clobetasol 0.05% topical cream once daily to the affected areas. And she revisited the clinic with much improved symptoms. And you can see that in figure 2 right there. So the complete pathogenesis of sweet syndrome is largely incomplete, but recent research has provided valuable insights into the involvement of inflammatory activation, abnormal cellular signaling, malignant transformation, and genetics. And more recently, we've been seeing more sweet syndrome cases since the COVID pandemic, and this is likely caused by an exaggerated reactive neutrophilic response that manifests as sweet syndrome on the skin. And there's 3 types of sweet syndrome. There is the regular sweet syndrome, then there's malignancy-induced, and then there's drug-induced. And so this is a case of drug-induced sweet syndrome. And so in drug-induced sweet syndrome, a clear temporal relationship exists between the ingestion of the drug and the resolution of the lesions after the drug was discontinued, or if it was treated with steroids, that is temporarily associated. And our patients met all the necessary criteria for the diagnosis of drug-induced sweet syndrome. And studies have suggested that Scopri amplifies both the inactivated state of the voltage-gated sodium channels and GABA-mediated inhibition on GABA receptors. So we hypothesize that anti-epileptic medications may induce a hypersensitivity syndrome, which modulates the humoral and cellular immunity and upregulate the cytokine levels in sweet syndrome. And our patient's acute onset of these erythematous lesions raised suspicion of sweet syndrome that's caused by the medication that she started. And so in conclusion, this case report highlights a very interesting case of a patient who presented with clinical symptoms of sweet syndrome after she started this medication, Scopri. And to our knowledge, this patient represents the first case of Scopri-induced sweet syndrome. And although drug-induced sweet syndrome occurs in less than 5% of the total sweet syndrome cases, we wanted to stress the importance of inquiring about recent drugs and updating medication history as part of the clinical visit for each patient. And that is all I have for this poster. Thank you so much.